Hello viewers, today we want to talk about gluten because in most cases I've told people about gluten, but I find that I really have to explain. So today I've decided to do a video so that we can all be on the same page. So let's talk about gluten and what is gluten-free. Let's first of all define what is gluten. Gluten is a structure of protein naturally found in certain cereals grains. The term gluten usually refers to a combination of prolamin and glutenin proteins that naturally occur in many cereals, which can trigger celiac disease in some people. The types of grain that contain gluten include all species of wheat, common wheat, durum, spelt, khorasan, emmer, einkorn, and barley, rye, and some cultivars of oats. Moreover, we also have crossbreed of some of these grains that contain gluten. An example is triticale. Gluten makes up to 70 to 85% of total protein in bread wheat, which is common in the world. Gluten, especially triticale glutenins, have unique viscoelastic and adhesive properties, which give dough its elasticity, helping it raise and keep its shape, and often leaving the final product with a chewy texture. These properties and its relatively low cost make gluten viable to both food and non-food industries. Wheat gluten is composed of mainly two types of proteins, the glutenins and the gliadins, which in turn can be divided into high molecular and low molecular glutenins and gliadins. Its homogeneous seed proteins in barley are referred to hordeins, in rye secalins, and in oats avenins. These protein classes are collectively referred as gluten. Bread produced from wheat grains contain gluten. Now, what can gluten trigger? Gluten can trigger adverse inflammatory, immunological, autoimmune reactions in some people. The spectrum of gluten-related disorders includes celiac disease. In 1 to 3% of the general population have celiac disease. Non-celiac sensitivity is 0.5 to 13% of the general population. So if our population is 8 billion, how many of the 13% do we have? Quite a good number. So it is a cause to worry. As well as dermatitis, herpetiformis, and gluten ataxia, and other neurological disorders. These disorders are treated by gluten-free diet. Now, we'll go to the celiac disease so that we can now understand what it is, as well as we shall also look at the other diseases that you have talked about, which affect the 2% and the 13% of the general population. Let's start with the celiac disease. Celiac disease, or CD, is a chronic, multiple organ autoimmune disorder, primarily affecting the small intestine, caused by indigestion of wheat, barley, rye, oats, and derivatives that appear in genetically predisposed peoples of all ages. Celiac disease, it is not only gastroesophageal disease because it may involve several organs. Now, and it can cause extreme variety of non-gastrointestinal symptoms, and most importantly, it may appear asymptomatic. Many asymptomatic people become accustomed to living with chronic bad health status as if it was normal, but they are able to recognize that there are symptoms related to celiac disease after setting a gluten-free diet, an improvement occurs. So once they switch to the gluten-free, the aspermatic changes, improvements are seen. Other difficulties for diagnosis are the fact that serological markers, those are anti-tissue desglamenase, which is TG2, are always not present. And many people may have minor mucosal lesions without atrophy of the intestinal villi. Chronic disease affects 1.2 of the general population, but most causes unrecognized, undiagnosed, and untreated, and at a very risk for long-term health complication. People may suffer severe disease symptoms and subjective to extensive investigations for many years before a proper diagnosis is achieved. Now, when this occurs, untreated celiac disease may cause malabsorption, which is reduced quality of life. That is iron deficiency, osteoporosis, an increased risk of intestinal lipomas, a greater mortality. Chronic disease is associated with some autoimmune disease such as diabetes mellitus type 1, triticale, gluten ataxia, psoriasis, vitiligo, autoimmune hepatitis, dermatitis, herpetiformis, primary sclerosing cholangitis, and many more. Celiac disease with classic symptoms, which include gastrointestinal manifestations such as chronic diarrhea and abnormal distension, malabsorption, loss of appetite, and impaired gut. In current, the least common form of disease and affecting small children, generally younger than 2 years. That is the impaired growth. Chronic disease has also non-classical symptoms. It's the most clinical type, and this occurs mostly in older children over 2 years, adolescents, and adults. What are the characteristics? They may be mild, even absent gastrointestinal symptoms, and a wide spectrum of non-intestinal manifestations that may occur, involve any organ of the body, and very frequently may be completely asymptomatic, both in children, which is at least 43% of the cases, and adults. Let's look at asymptomatic chronic disease. It is present in majority of affected patients and characterized by its absence of classical gluten intolerance signs such as diarrhea, bloating, and abdominal pain. Nevertheless, these individuals often develop diseases that can be related to gluten intake. Gluten can be degraded into several morphine-like substances, namely gluten exophins. These compounds have proven that they have opioid effects and mostly could mask the effects of gluten protein on the gastrointestinal lining and function. They normally mask because they cannot be seen in the normal spheres. Now, you also talked about the non-celiac gluten sensitivity, which affects 43% of the population. So, the non-celiac gluten sensitivity is described as a common condition for multiple symptoms that improves when switching to gluten diet. Then, once you switch to gluten-free diet after celiac disease and wheat allergies are excluded. This was recognized in 2010. It is included among the gluten-related disorders. Its pathogenesis is yet to be understood, but activation of the innate immune system that direct negative effects of gluten and other wheat components. The non-celiac gluten sensitivity is a common syndrome of gluten intolerance with a prevalence of 6 to 10. It becomes a common diagnosis. But the prevalence is difficult to determine because many people self-diagnose. That is, they don't go to proper medical institutions and start a gluten-free diet without having previously tested for the celiac disease or having dietary prescription from a physician. People with the non-celiac gluten sensitivity and gastrointestinal symptoms remain habitual and in no man's land without being recognized by the specialist. And maybe lacking of the lack of medical equipment and treatment. Most of these people have a long history of health complications and unsuccessful consultations with the numerous physicians trying to get a diagnosis of celiac, but they are simply labeled as irritable bowel syndrome. And in most parts of the world, most people also don't have health insurance, and most people also don't go for checkups. So a consistent and defined number of people eliminate gluten because they identify it as they're responsible for their symptoms, and then they improve with a gluten-free diet, they self-diagnose, which is not a bad thing. It will help eventually. People with this kind develop gastrointestinal infections which resemble that of irritable bowel syndrome or wheat allergy. A wide variety of non-gastrointestinal symptoms such as headache, chronic fatigue, fibromyalgia, atopic disease, allergies, neurological diseases, or psychiatric disorders, among others, which can come out of that. This comes from the study of 2077 that suggests that they may be chronic as the case of celiac disease. Besides gluten components present in wheat, rye, barley, oats, and the derivatives, other proteins called amylase trypsin inhibitors and short chain of carbohydrates known as FODMAPs may cause non-celiac glutenine sensitive symptoms. A study of 2019 reveals that FODMAPs present in wheat and related grains may play a role in non-celiac gluten sensitivity that can only explain certain gastrointestinal symptoms such as bloating, but not the extra digestive symptoms that people with non-celiac sensitivity may develop, such as neurological disorder, fibromyalgia, psychological disturbances, and dermatitis. Now, let's go to the wheat allergy. People experience adverse effects of wheat as a result of wheat allergy. As with most allergies, wheat allergy causes the immune system to respond abnormally to a component of wheat that is stressed and threatening foreign body. The immune response is often time limited and does not cause lasting harm to body tissues. Wheat allergy and celiac disease are different disorders. Gastrointestinal symptoms of wheat allergy are similar to those of celiac disease and non-celiac gluten sensitivity, but there is a different interval between exposure to wheat and onset of symptoms. The allergic reaction to wheat has a fast onset from minutes to hours after the consumption of the food containing wheat and include anaphylaxis. That's the difference between which allergy it takes immediate, but for the celiac disease it takes time. Let's go to the next one, which is gluten ataxia. A male with gluten ataxia, previous situation and evolution after 3 months of gluten-free. What is gluten ataxia? It is an immune disease triggered by ingestion of gluten. With gluten ataxia, damage takes place in the cerebellum a balanced center of the brain that controls coordination and complex movements like walking, speaking, swallowing, and loss of Purkinje cells. People with gluten ataxia usually present gait abnormality or incoordination and tremor of the upper lips. Evoked nysgamics and occur signs of cerebral dysfunction and are common. Myoclonus, palatal tremor, and opsoclonus myoclonus may also appear. Early diagnosis and treatment with a gluten-free diet can improve ataxia and prevent its progression. The effectiveness of the treatment depends on the elapsed time from onset of the ataxia until diagnosis. Because of the death of neurolysis in the cerebellum as a result of gluten exposure is irreversible. Gluten ataxia accounts 40% of ataxias of unknown origin and 15% of all ataxias. Less than 10% of the people with gluten ataxia present in gastrointestinal symptoms, yet about 40% have incessant damage. You can see how much it is in the population, 40%. Let's talk of other neurological disorders. In addition to gluten ataxia, gluten sensitivity can cause a wide spectrum of neurological disorders, which develop with or without the presence of digestive symptoms or intestinal damage. These include peripheral neuropathy, epilepsy, headache, vascular dementia, and various movement disorders, restless legs syndrome, chorea, Parkinsonism, Tourette syndrome, palatal tremor, myoclonus dystonia, optic myoclonia syndrome, paroxysm, dyskinesia, and mecomia. The diagnosis of the underlying gluten sensitivity is complicated and delayed when there is no digestive symptoms. Other people who do not experience gastrointestinal problems are more likely to receive a correct diagnosis and treatment. So it means in other people it cannot be seen. Therefore, what is the way out of this? A strict gluten-free diet is the first line of treatment, which should be started as soon as possible. It is effective in most of these disorders. Now, when dementia has progressed to an advanced degree, the diet has no beneficial effect. Now, see, at times when they say prevention is better than cure, this is now when it comes in. Cortical myoclonus appears to be treatment resistant on both gluten-free diet and immunosuppression. Now, how do you know the kind of food that you want to eat? We are talking of when you walk into any vendor, supermarket, grocery stores. Now, there's this part that is called labeling. People with gluten-related disorders have to remove gluten from their diet strictly. So, I need to read labeling rules. The term gluten-free is generally used to indicate supposed harmless level of gluten rather than complete absence. The exact level at which gluten is harmless is uncertain and controversial. But according to a 2008 study and a review, tentatively conclude that consumption of less than 10 milligrams of gluten per day is unlikely to cause intestinal damage in people with celiac disease. Although it is noted that few reliable studies have been done, regulation of label gluten-free varies. Now, let's look at what the international standards say. The Codex Alimentarius, that is the international standard for food labeling, has a standard relating to labeling of products as gluten-free. It only appears to food that will normally contain gluten. So you should be able to look out for that so that now you can become gluten-free. Whether diagnosed or not diagnosed, you can see the effect that it does. We have seen 40% of the people are untreated and diagnosed. So let's embrace healthy living so that with the healthy living we can be able to leave the world a better place. With this information, Currently, please like, comment, share, so that now you can make the world a brighter place. Light each and everybody's candle. In case of any information that you need to be clarification, kindly DM. We are here to give knowledge so that the knowledge can help you live a better life. So thank you very much for listening. All the best. Next, we shall be looking at what is a gluten-free diet composed of. Thank you for listening. Bye for now.